just after 10 o'clock, so we'll just get started. So first of all, let me just say thanks for taking the time out and joining the webinar today. It's a really busy webinar, which is great. That means that, you know, it's a really important subject that's close to a lot of people's hearts and minds. So just a little bit about me. My name is Sheila from BMR Health and Wellbeing. My background is in continuous improvement, lean and quality management. So I spent most of my working career in supply chain and operations in the electronics industry. Okay, so a little bit about BMR. So BMR is an organisation that looks to support both workplaces, secondary schools and universities to look at implementing workplace wellbeing in a very systemic and data-driven way, okay, when it comes to employee and student well-being. And what we do specifically is we look at treating not just the symptoms in terms of triaging mental ill health with mental health first aiders and EAP systems, but we look at taking that back and looking at actually what is the root cause of the factors that are causing people to be stressed in the workplace. And we do that by applying the law according to health and safety and quality management frameworks to ensure that we end up with a structured approach to organisational well-being, which is actually driven by measurable outcomes, okay, so that we can actually measure and see that what we're actually doing in terms of workplace well-being is actually doing what we want it to do and having the desired impact, which is less stressful people and a return on our investment. Okay, so today's discussion points, just to go through what we're going to cover today, we're going to look at the statutory legal requirements for workplace mental health in the UK. I've done quite a few of these webinars. We run this on a regular basis, and that is one area that people don't seem to be very clear on. So we're going to go into that today. We're going to look at the consequences for businesses who fail to meet those requirements. We're also going to look at the size of the problem in terms of mental health in the workplace. Some of you who've done your MHFA training, you will be aware of some of those stats. Some of you that are already running workplace wellbeing programs will also be aware of those stats. But we're just going to go over those again and the impact of COVID-19. And then we're going to look at what is an integrated approach to workplace wellbeing. And then the most interesting one for me, which being a bit of a quality standards geek, I love, is ISO 45003, which is an international standard, which is a framework and very granular detail on how organisations should be managing psychosocial risk. Yeah. And in terms of that, what is psychosocial risk? What are psychological hazards? So we'll have a look at that, and we'll have a look at just some very simple measures that we can have in place in terms of measuring our wellbeing return on investment. Now, as we go through the session today, you will have questions. What I'd ask you to do is to drop those in the chat, and then at the end of the session I can go through the chat, and if there's anything that we haven't covered, we can address that. We're using a platform in terms of our ISO 45003 compliance that helps you to perform all of these risk assessments, etc. If anybody wants access to a demo of that platform after the meeting or during the course of the meeting, just drop me a private message in the chat, just telling me whether you're interested in looking at workplace platforms or schools platforms, and how many users you'd be looking at that for. It's a free 30-day trial that we put in with that comes with the platform. And I'm also running another webinar on Monday at 10 o'clock that just runs through that in a bit more detail. But today is very much focused on what your requirements are as an employer. Okay, fantastic. So the health and safety legal framework in terms of UK law. We ran this webinar the other week with the Thames Valley Chamber, and it was interesting that people were not everybody was clear on what the UK legal requirements are. So in terms of the structure of the legal framework, we have the Health and Safety at Work Act, which is what you have to do. Okay, so in law, what you have to do as an employer, as far as reasonably is practicable, yeah, is to ensure the health, safety and welfare of all your employees. And that includes the psychological welfare, not just the physical welfare of all your employees. So you have a duty of care to do that under law, okay, under the Health and Safety at Work Act. Now, what you've then got that sits under that are the regulations that support the Act, okay? So the Management of Health and Safety at Work Regulations, 1999, actually state that how you need to do that, okay? So it requires you as an employer to carry out risk assessments, and those risk assessments are specifically, yeah, around psychological hazards. Okay, sorry, I got distracted by the chat. I'm not going to look at it till after. Specifically around psychological hazards. So the law is very clear. It's telling you what you have to do. You have to look after your employees, yeah, and you have a duty of care to look after their welfare. And then the regulations say this is how you have to do it. So if the health and safety executive, if the health and safety inspector was coming into your organisation, yeah, to look at somebody's arm fingers got cut off because a machine guard was off a piece of equipment, okay? First thing they'd look at you in terms of records would be, where's your risk assessment for that piece of equipment? Where's your risk assessment for that part of the process? Psychological stress and psychological hazards are no different. You need to have done a risk assessment, okay? So it's very, very clear, okay? We then have best practice guides that exist, okay, around workplace wellbeing. Organisations like the Health and Safety Executive have actually published things like the stress management standards that tell you what the psychological hazards are, and we'll come on to that a bit later, and basically some top level guidelines on how to do it. And then we've got further guidance and further granular detail, which are very specific frameworks of how you should be structuring this in the workplace. And this is where ISO 45003 comes in. So we've got, the main act is the Health and Safety Act with the Health and Safety at Work regulations, but there are other areas of law, okay, whereby employers can be held to account. So there's the Equality Act, which now includes harassment, and it also includes mental health under disabilities. And there is also the Protection from Harassment Act, okay, which is there to protect you in case of more serious cases of harassment, okay. So just to look at some of that in case law, and I'm not going to go into much detail on this, you can make a note of the case law and kind of do some research on it. But the law is very clear. So back, as far back as 1995, Walker there's a case of Walker versus Northumberland, and that set the case law, that was the case law that set the precedent, okay, around the employer's responsibility in terms of protecting, sorry, I'm just getting more people today, protecting the employee from psychiatric injury, okay? As I say, I'm not going to go into too much detail. They're just the headlines of the case law. So the Walker case set the precedent. There was another case then of Barber and Somerset that came later on that set 16 principles, which are kind of the guiding principles by which cases are decided, okay? So again, I'll be providing these slides for you at the end, and there'll be links to those cases so you can do a little bit of further reading. I'm no lawyer, so I'm just kind of giving you guidance here on those cases, yeah? But in Barber v Somerset, the employer must be in breach of the duty to take reasonable care of the employees. That's back to the Health and Safety at Work Act. But the employee must prove psychiatric injury caused by the employer. So there's an onus of burden of proof on both parties, okay? And it must be seen that it's been reasonably foreseeable on the part of the employer. So if somebody's been to you and says, I'm suffering from stress because my workload's too heavy, yeah, you didn't do anything about that, then it was reasonable, and that person then goes off sick because you didn't make a change to that working environment. it was reasonably foreseeable that that employee was going to have an issue. Okay, so familiarise yourself with that and be aware of that. There are more recent cases these go to 2006 with Majewski and Guy St Thomas NHS Trust Hospital, which again set a precedent for a breach of statutory duty under vicarious liability. So if you're working on a breach of the Act, i.e. the Health and Safety at Work Act and the regulations, that is criminal law, okay? But if you're looking at vicarious liability, that is civil law, okay? So there's two variations in terms of the rights of redress in terms of the law. So Majewski versus Guy St Thomas, that set the precedent for vicarious liability with harassment under the Protection from Harassment Act. And then a more recent case, which some of you may be familiar with, was Helen Green versus Deutsche Bank. And this was around a case of bullying. And Helen was actually awarded under the Protection from Harassment Act under vicarious liability, £800,000, okay, for future loss of earnings. And then a separate £35,000 for the psychiatric injury, okay? So these claims are there, the law exists, it is real, and it's interesting that, you know, that so far we've only ever really focused as employers on the safety aspect and not the welfare aspect. But we've got COVID, yeah? We've got this mental health pandemic, okay? And this welfare piece has never been more important in terms of protecting the psychological health of our employers. It's as important as protecting them from chopping a finger off with the lack of a guardrail, okay? So if we want to then start to take a look at the size of the problem in terms of the statistics around mental health, and this is some of the stuff that you might already be familiar with, it costs the UK economy a fortune. Okay, so the cost of mental ill health in the UK, and bear in mind, you know, all of these numbers are pretty conservative, okay? It's estimated to be between 42 and 45 billion pounds every year, okay, is the cost of the economy. And you can see, and to organisations, sorry, and you can see how this is made up, okay? So this is a report from Deloitte and Touche. They updated their numbers in October 2020. And they're saying, conservatively speaking, £6.8 billion per year is lost in absence cost. There is 8.6 billion in turnover costs, and this is all related to psychological health. And then this presenteeism cost, which is estimated it can be as high as double as that, is between 26 and 29 billion. So what do we mean by presenteeism? I mean, we've all been there. We have those days where we're not feeling on top of our game, and we go into work and we turn up for the day and we drink coffee and we're there, we're physically there, but we're not doing anything. We're not being productive. We're just having one of those days and we're coasting it, okay? And that might just be an occasional day. That might be a run of days. That could be weeks, and with some employees that come into months. So you could have people in your organisation that are turning up every day, but they're not really contributing. And the cost to your business in that respect is huge because your productivity is down. There are lots of different impacts that can have throughout your business, but really difficult one to quantify. There is a report from Deloitte and Touche, if you want to look at how they've actually quantified those numbers. They actually give you a breakdown of how that's all made up if you're a numbers person and want to get into the detail. Now, it's not all bad news because there is demonstrated case studies that have been carried out that show that there is a definite return on well-being, okay? The average number, according to Deloitte, okay, is around about £5 back for every pound that you spend. Now, in this current climate, working in your business, can you get that kind of return on investment? Yeah, so for every pound you're invested in the welfare of your employees, you'll be getting £1 back. And that's an average number. It's been reported as high as 9 to 1. It's been reported as low as 3 to 1. Okay, so the point is there is a return on that investment. And I think another thing, and this number goes up every day, and I think, you know, Melissa, you just, or you're about to complete some training on the mental health first aid stuff, and you know, we look at these suicide stats every week, and in the time that we will sit on this webinar, by the time we get to the end of it, about 130 people would have taken their life globally, death by suicide. So it's a phenomenal problem, okay? And, you know, at one point last year, the death by suicide was only around about 15% behind death by COVID, okay? We know that the death from COVID will start to subside because we'll have a vaccination. There's no vaccination for suicide. So as employers, you know, we need to be providing as much help and support to the people around us as we possibly can, because everybody, you know, employers, individuals, all of us, we have that duty as human beings to be able to help and support other people, but knowing how to do that and having those skills is really, really important. And yeah, you can check all of these stats, so all the sources of the data are on there. And if we break that down and look at that on a UK level, okay, 18 people a day dying by suicide. The numbers were 6,200 for last year. They've not been officially finished yet, but the UK figures are around about 6,200, 66,500 a year, and 75% of them are men. There is an increase in the younger generation as well, and there is an increase in the stats for women. So it's just generally, you know, sadly, it's increasing all round. Okay, so in terms of workplace mental health and how we do that in the UK, some of you will be familiar with these. We'll have mental health first aid. So we'll have mental health first aid trained people in our organisation. We'll have employee assistance programmes in terms of doing some health promotional stuff. We might be doing some exercise classes, some nutrition workshops, a bit of meditation, fruit bowl Fridays, yoga classes. All of these are great, but they're not targeted. They're not specific in terms of health promotion activities. They're nice things to do. And mental health first aid is all about treating the symptom, but what are we doing about getting to the root cause of what these factors are, okay? And not all employees work, not all stress that an employee is going through will be as a result from the workplace, but it's in your workplace 8 hours a day. So it's impacting your business. So the more you can do to help that person, sorry, I forgot to put my phone on silent. The more that you can do to help that person, the more productivity you're going to get within your organisation. Sorry, let me just put this on to silent. Okay, so that's how workplace mental health is traditionally done. What we want organisations to look at now, and how we work with organisations, is to look at an integrated model of workplace mental health. And when we say an integrated model, what we're looking at here is a workplace that promotes physical, psychological well-being, and then actively works to prevent harm. And I want you to just bear those 2 points in mind. So actively working to prevent harm, i.e. risk assessing your workplace, and then doing activities that promote psychological well-being. And by doing those activities, that might be meditation, it might be yoga classes, it might be fruit bowl Fridays, but actually let's get the data. Let's understand what's going on in the workplace and see what actually are the health promotion activities that our employees need and that our employees want, okay? There's no point giving employees access to gyms and access to yoga and meditation classes if they're so overloaded with work that they haven't got time to come up for air. Never mind find the time or feel even more pressure to have to go off and do yoga at lunchtime or whenever that may be. So we need to know that we're doing the right things for our employees, okay? So, is my next bit coming up? 1 second. Okay, so there we go. So what we've got here in terms of this integrated model of workplace mental health is looking at the mental health continuum. So for those of you that have done some mental health first aid training, we all exist somewhere on a continuum of mental health, and we will all move around this continuum of mental health, you know, and we'll all be able to recognise if we're flourishing, and flourishing is this psychological term for optimal well-being. We've had those moments in life where we feel like we're really winning, we're on top, we're absolutely flying, we're in a real good, positive place of being motivated and feeling optimally well, we're doing all the right things for ourselves, we're extremely motivated. That's fantastic. A small percentage of us will sit in there from time to time. We'll dip in and we'll dip out. Most of us will exist in this period of this space of mental wellness. So we're doing well, we're doing fine, we're going along in life, and that's great. But then occasionally we will drop into what we call languishing. So we don't have a diagnosable mental disorder. We're not mentally well, we're not firing on all cylinders. So we might be going through a divorce, we might be going through a bereavement, we might be going through COVID and homeschooling, and we might just be being knocked off kilter and not feeling 100%. But we're not diagnosably mentally ill. We've not got an ill health issue. We're just not 100% on top of our game. And then we have people that will have a diagnosable mental illness, okay? So people that will be suffering from depression or anxiety or bipolar or psychosis or any of these other mental illnesses that exist, okay? And actually, think about the size of your workforce. 1 in 4 people in your organisation, 1 in 4 people probably on this call, will have had or will have a current diagnosable mental illness, okay? That doesn't mean to say that they're struggling. They can have a diagnosable mental illness and still be mentally well because they're coping and they're managing that well. But the important thing to note here is that at least 1 in 4, will be ill at some point in time, okay? So people in your workforce are in all areas of this continuum. So what you need to do from an integrated model of workplace health is look at addressing people wherever they sit on that continuum. So we need to do 3 main things here. We need to look at mitigating illness. So what do we do when people are not well? How do we help them? So we've got mental health first aiders. This is what we traditionally do, okay? In the UK, this is our traditional approach to workplace wellbeing. So it'll be an EAP system. Great. We may have return to work policies that are specific around psychological health. Do we have policies, or do you have policies in place that support people that have come to you and said, I'm not really struggling well, I'm not really doing well at the moment. I'm struggling, say, for example, with COVID. I'm struggling with my workload and balancing life and kids and everything else. Do you have a recovery at work policy that actually enables you to sit down and agree an action plan with an employee so that you can look to alleviate some of that stress? So you may or may not have that in place. So a lot of what we do in the UK is very much centred around this bit here, okay? We do some of the stuff here around promoting flourishing. So this is our fruit bowls, our yoga, our nutrition, our workshops, etc. So this is where our health promotion comes in. But what are we doing in terms of the work environment? What are we doing about risk management? What are we doing about stress management? And what are we doing about education for everybody? Okay, so I've spoken to organisations, there'll be 500 or 600 people or 1,000 people strong, and they'll have 6 or 7 mental health first aiders. Okay, it's not enough. Yeah, those mental health first aiders are there to signpost people to support. Okay, once people become mental health first aiders, and we get this feedback a lot, there's a lot more pressure put on them, and then they start to feel the burden of being a mental health first aider. So it's not enough just to educate a small few in an organisation. You need to look at education for everybody. And one of the other key factors of education that you need to be looking at is not just all employee training, but one thing that lots of organisations miss is line manager training. Okay, so managers may know how to manage, they may know how to manage people, but do they know how to manage psychological risk? Okay, do they know what their responsibility as a manager is in terms of managing psychological risks. So line managers need specific line manager training over their roles, responsibilities, and how they should support employees that are struggling, okay? Because simply saying pull yourself together isn't gonna work, okay? So this is where we now then have ISO 45003 that comes in, okay? So ISO 45003 is a standard that sits within the occupational health arena, okay? So it's a voluntary standard, okay? So first off, it's not a compulsory standard, and it sits within ISO 45001. So in order to get 45003 audited certification, you need to have 45001 certification already. That doesn't mean to say that you can't use the ISO 45003 framework as best practice guidance for how you do your workplace wellbeing, okay? Because this is a global standard. It's been agreed by 72 different countries across the globe, okay? They've all come together to ratify what is the best practice. And this has been in discussion for a few years. It's had input from, you know, business leaders and psychologists across the globe, okay? So it's a really great place to start to build a solid, integrated workplace mental health program. So remember what I was saying before about an integrated integrated approach to workplace mental health was all about preventing injury and promoting harm. So preventing illness in the workplace and actively promoting well-being. That is the whole premise of ISO 45003, to prevent work-related psychological injury and actively promote well-being. Now, with BMR and working with the platforms that we use to do this, you know, workplace mental health is the shared responsibility. It's not just down to the employer to sort it out. The employer can do this. They can do the risk assessments, the preventing harm. We can do some health promotion activities as employers, and we can provide MHFA to do this illness, you know, to mitigate the illness. And that's great. And this is the employer's responsibility. But what we need to be doing as employees and as people that work in the organisation is we also need to take measures and take steps to make sure that we are looking after our own self-care. And as employers, we can help that by providing employees, okay, with some tools to allow them to do that. So this circle outside here, this is based on a psychological model called PERMA. So if I say to you, what are the key elements of physical fitness, okay, physical good health, yeah? You'd probably turn around to me and say, diet, nutrition, exercise, sleep. But if I said to you, what are the key pillars of what you should be practicing in terms of good mental health, most people look at me really blankly and would repeat the physical pillars of good health, okay, which do all contribute to mental health. But what we need to be doing is looking at this model of what we call PERMA, this psychological model, which is positive emotions. You know, if we're feeling positive and feeling happy, that makes us feel psychologically well. We're looking at engagement, you know, how absorbed we are in life and tasks. If we're looking at our relationships, the meaningfulness of work and accomplishment, all of these things give us a sense of well-being, okay? All can stress us out. Also sleep. Sleep's a huge factor, okay? So there's certain industries where sleep is an absolute safety factor, in so much as the rail industry, you know, problems with the fatigue, with people being tired, night shift workers, hospitality, NHS staff. You know, sleep is a massive hazard in certain work environments. So it's really, really important that when we're looking at this integrated model, we're covering everything. So in terms of ISO 45003, what does it cover? Now, for those of you who are familiar with quality management and quality management systems, okay, this is this circle of continuous improvement, okay? So ISO 45003 looks at telling how do we go about identifying the hazards, okay? So we can identify the risk, okay, using what we call within our platform and the tools that we use the work environment survey, the work design survey, and we use to look at the psychological workplace factors. And then we use the flourish surveys, okay, to look at these perma factors as to how people are feeling. And then we start to be able to identify those risks, okay? So that's great. So we've done step one and we've identified what those hazards are. What we then need to do, okay, is look at how we assess those risks in the workplace. And that starts with, you know, we've done a survey, we've got our results, we've identified our areas of risk. Now we need to pull together our health and safety team, like you would with physical hazards. You pull together your health and safety well-being management team, and we look at what those, what the potential of risk is, and we assess those risk factors. And from that assessment, we then look at what do we need to do? What do we need to do to mitigate those risk factors? And then we'll agree actions, we'll allocate resource, we'll allocate time, we'll allocate responsibility like we would with any other hazard. And then we go away and we start to do that, and we start to put that into practice. And then the key thing that we need to do is to then go back and go, has that had the desired effect? Okay, review the effectiveness by repeating the surveys and assessing the specific areas that we had, that we were intending to improve, to see, did it actually do what we needed it to do? Okay, so in terms of psychological hazards, what exactly are psychological hazards in the workplace? Well, the Health and Safety Executive states 6 of these in their stress management standards. We assess 8 with our survey tools, okay? So all of these, if they're not right, or if they are right, they can either promote workplaces that are amazing to work in, or they can give us horrible amounts of stress. Okay, so workload, too much, we're overloaded. Too little, we're stressing that maybe we're going to lose our jobs because we don't have enough to do. Okay, autonomy, are we micromanaged, or are we given the bandwidth in which to do our jobs? Are we really clear in terms of what our job is? Okay, do we get support from our managers? How is that actually dealt with? You know, how are relationship conflicts dealt with? So is that bullying in terms of harassment? Is the organisation dealing with relationship conflict well? You know, do our employees feel rewarded and recognised? How do they feel about change consultation when we try to bring new things into play? All of these factors have a massive impact on people's stress levels at work. And, you know, do they feel that the organisation is fair? You know, I've worked in offices and businesses for many years, you know, and it's things like, well, accounts will say, well, it's all right for sales. They always get, you know, they get away with that. It's all right for them. They're always going out for dinners and they're always doing this. And there's this inner conflict between departments. So it's important that as employers, we understand what they are. And then we can work at ways of how we can improve that. We might not be able to fix everything. You know, we're not talking about a utopian world here, but we can certainly understand what the main stresses are and start to fix those and put actions in place that can help to address that. And likewise, we can also understand the stuff that we do really, really well and do more of it. Okay, so we've done the assessment, we've looked at all these factors, we know now what the risk areas are. So the next step is to then pull that together in the form of a risk assessment plan, or a mental well-being management plan, or a workplace wellbeing management plan, whatever name you want to give it. You know, what we've got here is we've taken the results of our survey, we've got our department, okay? We have got our, sorry, I was trying to move this quick around. So what have we done? We've identified the risk factors. So in this case, we've got workload, cognitive demand and high, emotional demand are high risk factors. We've done a work survey. We're going to hold regular discussions with the team, and then we're going to reinforce these expectations. We're going to check the resourcing is adequate. But what we're doing here is we're putting in specific actions. We're allocating responsibility. We're putting in timed action dates. So these are all very smart measures when it comes to workplace wellbeing, specific, measurable, are they achievable, are they realistic, are they timed? Okay, is somebody accountable for them? So all of this comes in. So when the health and safety executive comes in and says, well, we've had lots of complaints about stress levels in your organisation. Can you show me how you actually deal with that? What are your risk management plans? It's there. You have it. Okay, and it just follows the basic risk management principles that already exist within your organisation. Yeah, and we just use different tools to be able to facilitate that. So we've had our survey, we've got our results, we've put a plan together. So we've done kind of 3 elements of the circle, but then now we need to go back and we need to look and review the effectiveness of what those actions were. And the way that we can do that is that we then resurvey, okay, the organisation. Our survey tools are really simple, quick and effective. They're all real time, so there is no heavy lifting when it comes to admin. There's no heavy lifting when it comes to data crunching. We do it all for you, okay? Or we give you the tools that will do it all for you, okay? So if we want to review the effectiveness of the actions taken, we can compare survey 1. We resurvey, we get the results, we know everybody's answered, and then we look at survey 1 and we look at survey 2. And then we can see how many responded the first time round, how many responded the second time round. We may just want to survey on 1 particular or 2 or 3 particular risk factors. We might not want to do a whole organisation survey. Okay, so the point is we can do the comparisons of the surveys and then we look at what changed for the better, what changed for the worse, and what didn't change at all. So what we're looking at is the risk factors that we identified, in which direction have they gone since we've put these control measures in place? Have we had the desired impact that we wanted to have? Okay, so you can very easily measure the effectiveness of your actions. Okay, so it keeps it going. If it didn't work, if it didn't have the desired effect, we go away and we start again and we look at, well, what did we miss? Why did we not get it right? If it did work, brilliant, let's go on, let's do the next survey, let's see what flags up next, until we get to that point where we're creating this workplace where people are generally happy. Okay, so in terms of the compliance, just to reinforce, okay, training of staff in mental health awareness alone is not enough. Okay, we need to do more, and risk assessments are an essential, absolute, vital piece of the puzzle here. Okay, and not only due to the fact that it's a requirement by law, very much about keeping it simple. Okay, if you went at this in certain ways, there is a danger that you could overcomplicate it. Just keep it simple, keep it driven by data, and make sure it's a fully integrated approach. Okay, now the ISO tool, the ISO standard, you don't have to be a huge organization to use it. It's applicable to all organizations in all sectors. It's about developing, implementing, maintaining, and in continually improving safe and healthy workplaces. No different than you do with physical health. Okay, so in terms of the compliance tools that we're able to support you with, that will be your risk assessment tools. From those risk assessment tools, we can, identify the gaps, we can focus on areas of risk, we can take this systemic approach, and we've got a measurable audit trail. Okay, the management tools give us all the data analytics, they give us the risk management plans. We're able to provide you with whole organisation training and work with you to look at the KPIs specific and relevant to your business, because all businesses are different. We will have the same core of KPIs across all businesses. There will be some key measures in there that we can do, but then there may be specifics relevant to your organisation that we can build in. And with our employee surveys, we're getting anonymised data. And I think this is a really important factor is that, by having anonymised data, by completely protecting the employee, we're more likely to get that clear and honest feedback. Because being told what somebody thinks we want to hear and being told the truth can be two very, very different things. So we're getting this anonymised data, it's real time, we can compare the data, we can review and look at the effectiveness of the data, and we've got this whole organisation approach, okay? So the platforms that we use have all of this in. We've got Flourish DX, which is if we're in schools, we can use that for the faculty, but we also use that for workplaces. And then if we're in schools, we've got a whole separate product that looks at pupil care, okay? But in terms of the Flourish platform, we've got the surveys and data analytics, just to go over that again, the risk management tools, the line manager training, mental health education for all. And then as far as the employees are concerned, we've got some self-care tools for them with wellbeing check-ins, stress reduction activities and digital coaching, okay? So we've got all of this built into the platform. If we're looking at schools, and I know we've got a couple of people on the call from the education sector, the schools product is aimed very much at secondary schools, colleges and universities. And it starts to become a pastoral care platform as well. So unlike the work platform with the skills platform, we can de-aggregate the data and look at it on a pupil to teacher, pupil to faculty kind of care system, and help pupils to work through and develop their wellbeing aims and goals. But that's another kind of webinar. Really, so I'm not going to go into that into too much detail. You will have these slides after the webinar today, so you can kind of pick up the information that you need, okay? So just moving on, getting towards the end now, we've then got how we measure, okay, workplace wellbeing. So there's some really, really simple measures. Within some of the survey tools that we've got, we can look at things like intention to quit, okay? So how many of your staff, given the chance, would walk today, okay? So that's a really good indicator as to how well your people are feeling, okay? We can also look at percentage of holidays used. You know, these are just quick numbers that you can go away from today and start to have a look at. It won't be difficult for you to get hold of them. But if you look at percentage of holidays used versus unused, and I know COVID's thrown a bit of a spanner in the works this year, but look at previous year's data. If people aren't taking the holidays, what's that saying about your organisation? Yeah, they're saying that they've got too much work on, that they can't afford to take time off, okay? That they're feeling stressed about being away from the work environment, yeah? So we need to understand why that is. Other KPIs that we can look at in terms of employment are things like your absenteeism rates and your absenteeism costs. So again, just because it doesn't exist on the bottom line, just because it's not in your monthly accounts, yeah? You've got this block of staff costs, yeah? Your staff costs will be about, in most organisations, around about 70% of your total costs, okay? Who on this call, as an organisation, breaks down that staff cost and says, out of that staff cost, X% was absenteeism. You know, we were paying people for being off. We were paying people for being sick. Out of those staff costs, how does that break down? So look at your absenteeism rate and your absenteeism cost. And I can tell you now, the figures and all of the studies out there show you can halve that. That's the cost of stress to your business. Okay, 50% of all sickness, regardless of what people are calling in and telling you is wrong with them, whether it's a migraine, a headache, an upset tummy, 50% of all of your sickness will be specifically related to stress. Okay, you can also look at things like the average length of time that people stay with you. So again, if people are leaving you on a regular basis, you've got recruitment costs. What are you spending with recruitment agencies? You know, what we want to do is we want to keep people, okay? We want to invest in people in our organisations. We don't want to keep paying to hire them, bring them in, train them, let them go, repeat again. It's all cost to your business. And then again, if we're looking at attrition rates of employees, so it's looking at how long they're staying, but then of the employees that are leaving under their own volition, yeah, how long have they been with you? What are the reasons for them leaving? Okay, is that saying something about your business? If you've got a high attrition rate because you're getting rid of people, what does that say about your recruitment process? Okay, so these are figures that you can start to look at in terms of understanding whether you know what your base numbers are within your business. Okay. And then just going back and recapping on this continuous improvement model, we are able you will be able, with the tools that we have, to demonstrate your commitment to continually improving your approach towards psychological health and safety. So what we have in the platform is what we call the flourish factor. And what this does is it measures the maturity of your approach towards psychological health and safety. So it scores you against key elements of the ISO 45003 standard, okay? And it gives you a score of how you're doing. As you put more activity in there, as you put more actions in there, as you comply with more elements of the standard, as you develop your systems, your score will grow, okay? So from an audit perspective, from an auditor trail, from demonstrating best practice, this will do it for you. You've got this flourish factor here. We look at governance, we look at the education section, we look at risk assessment, risk mitigation, and the admin, okay? So the point I want to make here is that well-being is no different to physical health. When we're looking after well-being in the workplace, it's all about taking a systems level approach in the workplace, okay? And I often hear, okay, this phrase, right, which drives me insane, okay, which is our people are our greatest asset. And I see Michelle smiling because she's heard me speak about this one before. But, you know, we invest in equipment, okay? So we invest in a piece of machinery on the shop floor to produce widgets, okay? So that machinery may cost us, I don't know, £50,000, £100,000, okay? What we do when we get that machinery in, okay, is we establish a maintenance contract. We allocate responsibility to that, to maybe a maintenance manager. We look at the manual as to how to make that piece of equipment perform at the absolute optimal level to get the right output, okay, in the right way. So that machine is firing on all cylinders all the time and we're getting our money's worth, okay? Because that machine is an actual asset in your business. It exists on your balance sheet, okay? But so do your people, okay? But where is their maintenance contract? Where is their optimizing of their well-being, okay, to make sure that you're getting the best out of them, you know? So if you're going to say your people are your greatest assets, treat your people like they're your greatest assets, okay? And I just really think about that, because, you know, it's the difference between actually paying lip service to workplace wellbeing programs and actually doing programs that will give you a return on investment and where people feel valued and that they are one of the greatest assets within your organisations, which then makes you an employer of choice, okay? And people will stay with you. People do not leave good employers. People will always stay in organisations where they feel that they care. They will not be pulled away by a couple of extra £1,000 in salary. You cannot buy loyalty in the way that you can with care, okay? So what I'd like you to do is to know your numbers, okay? Go away and kind of understand what your absence numbers is. Just do some simple maths, yeah? And ask yourself, what are your employees worth, you know? If you could invest the equivalent cost of Starbucks coffee per employee per month, one coffee per month, would that be worth it to have something that would be a fully integrated approach to workplace mental health that would address everything that I've spoke about today? And also ask yourself, in this current climate, can you really afford not to do that? What is the impact of not investing in your workforce? What is the impact of not investing in your staff and looking after your people in a way that shows them that you really care? Because these workplace wellbeing programs, you can't pay lip service to them. People are not stupid. They know when you're box ticking. We have people on our mental health first aid courses that say, "Oh, I'm here because my boss sent me. They just want to get some mental health first aiders on because we don't have any. What else are you doing? Nothing. Don't really want to be here. Not really for me." And then we'll have other organisations that send people, and those people are like, "Oh wow, this is fantastic, but I've really got no support when I go back into the workplace to be able to do something with this. I'm really passionate about it, really want to make a difference, I really want to help." And then we have the third category where people go, "Actually, my boss wouldn't pay for this or my company wouldn't pay for it, but I feel that it's really important that I can support some of my colleagues. I'm paying for it myself. Okay. And that's the really sad part for me, is that some employers just don't want to support their staff. And it doesn't have to be expensive. It doesn't have to be costly. It doesn't have to be time consuming. It needs to be done well. Okay. And you just can't pay lip service to it. Okay. So what I'm going to do now, that is me finished. I'm actually going to drop into the chat a link whereby you can sign up for a demo account. It's a 30-day demo account. There's no big sell. There's no obligation to kind of follow up on it, but have a look at the tool that is there. Have a look at what's available to you. I'm booking a discovery call with me. We go through kind of what you're currently doing, where you could be going. You know, that's completely free to do. Okay, and I think it would be really, really worth you doing that. So I'm going to take the screen share off so I can start to have a look in the chat, and we can start to answer some of your questions, because the chat box is flashing away at me. Okay, so let me just stop that. Take a drink because I've spoken a lot. And 1 second. I can't get rid of my little pen. That dot thing. Okay, so Mike has asked, would the slides be available to download at the end of the presentation? Yeah, I'll be able to send that to, well, I'll be sending a recording, a link to the recording of the presentation, so you'll have access to everything there. In terms of the ISO 45003 standard, Vince makes a really, has dropped in the chat there, buy a copy. Okay, the ISO 45003 standard is available on the BSI website. Okay, there's a link to it that you can get from the BMR website as well in the resource page. It's about a tenner. Okay, it's about £10. It will just go, you know, it will give you the detail like an ISO 9001 standard would about everything that you should be doing. Okay. The standard's due to be released in mid-2021, okay? So it is coming out this year. So, you know, you get started 6 months down the line, you can be compliant, working towards that level of compliance with that standard. So again, from a, you know, from an employer perspective, that's a really good thing to be able to be demonstrating, okay? What's the one here from Vince? How do we plan and control that employees included into the programme feel it's down to them, they're not fitting off, their diet's poor, they don't fancy joining in? Yeah, we can't let the solution be worse than the problem, absolutely. Which is this whole integrated approach of doing this shared and supported approach to workplace mental health. Peter's going off, thanks for sharing. Okay, so I think that is most of the questions. Does anybody want to unmute themselves and speak or ask anything?
Is there any value to doing the survey in your layers of management?
You mean with your management team? Yeah, I think you have to do the survey across the whole organisation. Yeah,
but you almost don't want to contaminate the levels. So if you do the survey for the operator level, and then maybe do a middle management level,
yeah, absolutely,
senior management, so that you don't get it all kind of
mixed up
in then. Yeah,
no, absolutely, Maria. You so that, again, with the way that we set the platform up, one of the key kind of things that we look at with the way that we work with you is, what information do you want and from where? Okay, so that determines how we set the platform up. So do we want to be able to run management surveys? Do we want to do it on labourers? Do we want to do it on people that are working night shifts and looking at night shift transitions? Because different factors impact different types of workers. So you're absolutely right. You don't want to kind of contaminate it with different
data points.
Be relevant in all areas. So yeah, Absolutely, very, very targeted and specific risk assessments.
Okay,
Sheila.
perfect.
Hi, Vince.
Hello, Sheila. Just to support the point you're making, the duty of care
Yeah.
for the Health and Safety at Work Act and the Management of Health and Safety at Work regulations
Yeah.
is an individual duty of care. One size doesn't necessarily fit all.
Yeah. Vince, you've got a lot of
So
interference and noise. That seems to.
I don't know, that would be, the house is quite quiet, sorry.
Okay, it's gone now, whatever it was.
Oh, okay. Yeah, so the duty of care is an individual one.
Mhm.
So let's say you had a person who maybe had a musculoskeletal problem, and a work activity was going to make that worse. You would have to do something specific for that one person.
Yeah.
Not necessarily something for everybody.
Of course, and that's why we've got things like recovery at work processes where we can address specific things around specific people, for sure.
I think as well, following on from the correspondence that we had earlier or late last weekend, the listeners and the viewers here need to understand that Management of Health and Safety Work Regulation 3 duty is quite a profound and significant duty. It's important. Also, if there's any reason to believe that the control measures that are being put in place, planned, and the controls in order for people to not suffer if they are not working properly, they have to go back to that risk assessment to change it and change the controls. So let's just say in a practical sense, the use of the mental health first aid team or the employee assistance scheme is being used more than it was anticipated to be, and there's definitely a problem attributable to that work, then the employer has to do something about that situation. It's, you know, you mentioned so far as is reasonably practicable. This is the one we chatted about. It says you shall do this. There's no reasonable about it. You have to do it. I think it's quite an important point to highlight.
Okay, thanks for that, Vince. You've really got a lot of noise interference there. I'm not quite sure what's going on. I don't know if that's impacting everybody else, but it's but thanks for the point that you raised. So I think what Vince,
I hope it came through okay.
Yeah, maybe just follow up with a bit on the chat there, Vince. Eh?
Okay.
Yeah, that'd be great. Thank you for that. Okay, so does anybody else have any questions? Let me just. You can just feel free to unmute yourself. Anybody? No? Okay. Well, what I'm going to do is I'm just going to drop very quickly in the chat the link to the demo account, so you can kind of pick that up in terms of copy and paste if anybody wants that. I'll pick up those requests, and then what we can do is just to book in a quick call. Also on Monday at 10 o'clock, I'll do it in the follow-up webinar, sorry, the follow-up email. I will be running a webinar specifically around the platform and just show you how that works in terms of distributing surveys, pulling the data in, looking at the data, processing that, etc., etc. Okay. Hannah, thanks for your comments. So I popped that in there for everybody. I just really want to thank you for coming on today and listening to what we have to say.
Thank you. And I can look forward to continually working with you at BMR.
Thank you, Nikki. Great to have you on board. You went live today with Flourish, didn't you?
Yes, we have. So we just introduced it into the football environment where we're going to include all staff, players, anyone that really is involved with the club. Got some changes to make as a management team, but I think, you know, finally got everybody on board, and we're really looking forward with the help and support from Sheila, who's been absolutely fantastic and amazing, I've got to be honest. We're really looking to do some changes and look forward to changing the attitudes, and giving some more support to the staff moving forward. So I'm really looking forward to that. So thank you. And honestly, I can't highlight to anybody that's looking at it. It's such a fantastic system. And it's not only just helping your employees, it means that they can share it with their families, their friends, and you know, it's all in bite size. So with those that do suffer with mental health, I think sometimes too much information and overload can cause just as much, if not more, damage. Whereas the system actually allows you to go and do the bite size. So from an employee side, it's really helpful, and it covers such a wide variety in area: anxiety, sleep and depression. And there's tools as well for emergency help externally, but it's also got the information for the internal contacts and help as well. So honestly, have a look at it. It's just fantastic. And you know, and I'm happy to feedback with Sheila, and she can share later on. I'm really hoping that, you know, this is going to work really well. I'm happy to sort of give any feedback moving forward if anybody's interested. Then just let her know, and I'll feedback anyway. So
but Nick is with Bristol Rovers football club, and we you know, we're going to be kind of journeying the kind of story with the tool, and kind of how they've got along and how they found those benefits as well. So it'll be an interesting one to watch. But again, it's a very male dominated environment, supported by lots of lovely females as well. But it's a very, you know, there's very different cultures that exist, isn't there, Nikki? It's fair to say within a football club, very different dynamics. And one thing about the platform is that it's designed as a tool to be suitable for everybody. So if you're not into meditation, you're not into breathing exercises as an employee from a self-care tool, there's lots of science and data and information around it. So it's there to be an all-encompassing approach, because no two people are the same, and we all learn differently, and we all have different needs in terms of our support, and that's what we're looking to do with this. So
You're
thanks
welcome.
for that, Nikki. All right, thank you everybody, and I'll send you all follow-up emails, and hope to speak to you soon.
Thank you.
Thank you very much.
Thanks. Thanks. Bye-bye.